own, had to be accused of being perverse. He had begun to notice the symptoms of hysteria or neurosis among his own siblings. And if he stuck to his theory, then he had to deduce that they were sexually abused by his father. So maybe that's how we got the Oedipus complex, which seems a very convenient victim-blaming process for explaining fuzzy memories of sexual abuse. Oh yeah, every kid's fantasizes about having sex with their parents. Don't worry about it. It'll go away. But no more talk about incest. We don't want any of that. Consciousness is hard. There's no coming to consciousness without pain. People will do anything, no matter how absurd, to avoid facing their own soul. They'll take pain pills. Convert to heroin when they can't afford the pills anymore or can't get a prescription. So this process and this work that we do is about mindfulness and consciousness. And as a practitioner, you have to practice mindfulness and consciousness. And it's not easy. You're going to look at things, you're going to see things, you're going to experience things, both in yourself and in your sessions. Excuse me. Thank you. That you will not want to experience. You're going to make yourself available, get your own work done, and you're going to be able to sit with someone who's going through something that was very difficult for them. And you're not going to interrupt the process no matter how uncomfortable it makes you. We've had a lot of extreme situations come up with. One of them, I'll point out, a woman, had been beaten and kicked unconscious and kicked across the room while she was unconscious. In her session with an intern, I'm going to scare you interns now. In her first session with her intern, who did not have the full experience of being through these processes and developed all of this, trust the process kind of stuff, she got to that point when she went unconscious, and wouldn't you know, she fell off the damn couch, unconscious, in the room with the session. And the intern called the EMTs, who said, it's a stress response, go away. Yeah, okay. So the next day, Teresa was in the room too. Okay? She said, okay, well, I'm going to touch you at that point. Is that going to be okay? And we'll be here. And you know what? She went through the process. She went unconscious. And the exact amount of time that she was unconscious, she woke up. She finished her session, went through it several more times, and then she had an epiphany like this woman did here. And she no longer had a charge associated with it. Okay? Somebody has got to be willing to do that for you. And if you want to do this work, you've got to be willing to do it for somebody. And it might upset you. And you might need a session yourself afterwards, and that's our process. We do peer sessions at the agency. What you experience in somebody's session may have no connection to anything that's happened in your life, but as an empathetic, compassionate human being, it may traumatize you nonetheless. And if you want to do this work, you have to be willing to sit through that and allow their process without betraying any of your own stuff. There was a person in one of the workshops, her job used to be to take the stories of crime victims when they come through the prosecutor's office for first intake. And she said this 12-year-old boy came in. She was this very sweet person. She said this 12-year-old boy came in, took one look at her and said, you couldn't handle what happened to me, and he wouldn't tell her. You know? People will intuitively have that sense about you. And they're not going to want to hurt you. For somebody to open up to you, you have to be able to create safety. And we teach a discipline in the workshop and practice a discipline in the workshop of not betraying our own emotional process and being able to hold ourselves together in the face of that kind of thing in a session so that we can do that for someone. Mindfulness is the intentional accepting and non-judgmental focus of one's attention on the emotions, thoughts, and sensations occurring in the present moment. Consciousness is the quality or state of being aware, especially of something within oneself. And we have to be committed to that to do this work. And this is what people get out of receiving this work, is the ability to be mindful and conscious. There are 4 flows that may traumatize. Something that happens to you or is done to you. And we all know that. That's what we think of when we think of trauma. We think of something that somebody has done to someone, right? And that person who's received that is traumatized by it, right? There is something you observe happen or done to someone else. We're kind of familiar with that too. You know, a child sees his mother being beaten. That's traumatic, right? We understand that. He's not being beaten, right? All of the school children across the whole country who had TVs wheeled into their classrooms to watch the Challenger explode. That was traumatic. Their teachers were crying. So we know about those things. But there's also something we cause to happen or to do to someone else. That's traumatic for us. And something we do to ourselves. Now, I talked about the process before. We have these charged areas list, and we pretty much wring everything possible out of it. And yet, 3-4 sessions in, the person says, I've never told anyone about this, and I don't know if I want to talk about it. But when I was 16, I had an affair with my uncle. There's another way to say that. My uncle repeatedly raped me. Okay? But at the time, she was voluntarily participating. And she was concerned about what she had done to her aunt, to the other kids in the family by not saying something because she knows that they were ultimately treated to the same kind of behavior. And, of course, what she did to herself. And she couldn't even approach that until she cut some of the other layers off. That's the hardest stuff. That's the stuff we don't want to know about, what we did. Lots of times it's worse, so lots of times it's more unapproachable than the things that were done to us. We know we're going to get sympathy for the things that were done to us, or we think we will. But we don't want to confess the things that we've done. But we have to. Guilt is a feeling of remorse, responsibility for something we've done, whether real or imagined. It's a result of actions or failure to act. And because guilt is about action, we can do things to make up for the things we've done or not done. What time is it? Pardon? 1:43. Good. Fantastic. Great. Right? Confession. Right? We go, we confess, and we're given things to do. Right? We can make amends. 12-step program, we can make amends, right? That's about guilt. Shame is something else. It's an emotion in which the self is perceived as defective, unacceptable, or fundamentally damaged. It is the inability to ever do or be good or worthy enough. It results in perpetual, fruitless striving. It kills our ability to connect to others. Shame frequently results from trauma. There's nothing we can do about shame. You can't make it up. You can't out-earn it. You can get a bunch of university degrees. You can be at the top of your profession. You're always working, but you never work it off. It's existential. It goes to your right to exist. But your right to exist arises alongside existence itself. Everything that is has a right to exist. Innocence is not merely having done no wrong. Rather, it's the inability to do any wrong. It's the ultimate state of infinite worthiness. Innocence enables connection and healing. It is the opposite of shame. We reconnect with our innocence when we're able, willing to become vulnerable. When somebody can come in, and not everyone can, and sit in session and tell you what happened to them, and tell you what they've done, and tell you how it made them feel, and connect the dots between what happened to them and what they've done to themselves, and understand that they weigh 350 pounds because they don't want anyone to look at them that way again. Perpetrators, were they victims first? Almost assuredly. They're acting out events that happened to them. Many of them are responding to the ongoing trauma still active in the amygdala. It is often less, if you have to go through something again, it's less painful to be the perpetrator. Still sucks. Now, I'm not going to show this next one, simply a matter of time, but this was a bully. The session was about a bully. He'd come in and tendency to pick fights. He's like 30-something. And the session was about when he was sodomized at 5 years old in the orphanage. And he made the connection. Yeah. After that, I fought all the smaller kids because I wanted to be a really good fighter. And that was the way to learn how to fight, was to fight all the smaller kids. But he didn't consciously carry that knowledge forward, so he just continually, habitually picked on everyone he could. When he made the connection, he could stop. The rest of this presentation is about the chemistry and the biology and all that stuff, and we can certainly do that. But I'd like to take a few minutes for questions that we might not have time for otherwise. Okay? So we can do that now? Does anyone have a question or an observation? There you go.
So I'm an intern at the Trauma Resolution Center, and my question is, we can clearly see that she came to a resolution, and it's amazing that she doesn't have any more panic attacks, right? My thing is, from what I understand from trauma, what I've learned here at Barry University, is that in order to do trauma work, the person needs to be completely grounded and present. And from what I saw, because I've seen this video before, she was nowhere grounded. She was totally in the past. And so that's where I feel so split in two when we're talking about TIR. Because
Okay. What you saw there, and I'll let you hang on to that for a minute. You can give it to the next person. What you saw there was the middle of the session. All right? She made a conscious decision a rational, conscious decision to come in and do that work. And she had enough grounding to participate. Lots of times, you will encounter people who need work before they're ready for the trauma work. They may want it, but they're so distracted. Frequently, they have very chaotic lives, and things are going on in their lives. So this is sometimes where the yoga and the meditation and the other kinds of things come in to get somebody calm. And there's actually a process. There are interventions. Sometimes it's a matter of getting them off the street. Sometimes it's a matter of making sure they have some place to live, or that their kids they have care for their kids so they can come in for session on a regular basis and make time. So there's some support that needs to go into that process, particularly for people who are very distressed. We had somebody come in and take the workshop, and normally people who come in, we get some information about them. This was actually an intern, So anyway, we got to the process of where they were doing their own work, like you did when and you're sitting there, and he was telling the story of this thing that happened to him as a child, and he kept coming up with different versions of it, completely different versions of it. Are you on any psychiatric medications? 6. Okay. The purpose of some of those medications was to keep him from remembering. How are you going to do this work, right? So sometimes that has to be a part of the process as well, all right? So yeah, it's not simply always going to be like this. And there are lots and lots and lots and lots of people out there who need this work but don't want it. Some of them are perpetrators, We've been very fortunate because we've got a lot of people being referred from the Drug Dependency Court and from the Jail Diversion Program, and now what they call their frequent flyers, the severely mentally ill, who keep ending up in the justice system. And while one of the things that we know about this work is it doesn't work in the presence of somebody's resistance, we've also discovered that once somebody knows that you're concerned about what happened to them and not what's wrong with them, that frequently they will participate. Not because they were sent, but because they really know you want to help. And in those cases, they are successful. It's like a lot of things, A lot of people need it, but only some want it and can benefit from it. 15,000 so far. Okay. So, any other questions? She's over there. Quicker, quicker, quicker.
Hi. How can you apply this in a crisis intervention type of setting? How can you apply, the trauma-informed and be able to kind of deliver those services, especially as a clinician when you can't really control what's happening as far as maybe a psychiatrist or nurse or something like that?
Okay. It's a good question. First of all, one of the first things that we do in the TIR workshop is to develop the skill set and communications exercises, and those are very helpful from the get-go in situations like this. The ability to listen to somebody non-judgmentally and non-reactively, okay, while they're trying to push your buttons or they're all over the place, is a really good way to get them present and focused. All right? And it's not easy. It's something you have. It has something we practice it in the session, in the workshop, and then you need to continue to practice it. But as an example, one woman came to the workshop, and we've just done the first 2 exercises, 2 or 3, and then she went home that night, and she came in the next day, and she said, well, I wanted to practice that, and I was in the kitchen with my husband, and he told me something that he had never told me before, because he said it was the first time he felt safe enough. We normally listen to respond. We don't listen to understand. Okay? And once we do even some simple things, like when somebody's very upset, what do? We hand them a tissue, which basically says, you're making me uncomfortable. Stop it. What we do in session is we put the tissues where they can reach them and let them find them themselves. We don't respond. We don't react. Oh, you poor thing. We let them have their experience and don't pull their attention out of it or interrupt them. Okay? All of the things that we instinctively do that we think are helpful but are very often counterintuitive, that actually stop the process. Anyone else? Yes?
The workshops that you do at the trauma center, Trauma Resolution Center, are they open to the public or anybody who wants to get trained?
Anyone who wants to get trained can pay the fee and participate, okay? If you're an intern or volunteer, you can get a break on the price. We have them 4 times a year at the Trauma Resolution Center. You can check their site for the schedule or call to find out. We are also conducting them in Costa Rica, and so I highly recommend that. Yes, anyone else? Can you, yeah, soft voice, big microphone.
Yes. Are these
Let it out.
PowerPoint available? Are we going to have access to them?
Yeah, I can put a PDF out there. It's a huge PowerPoint, but I can put a PDF out there. I'll pull out the video and put it out there for somebody to make available on the web. Okay. Anyone else? Yes.
Hi. In situations where you do have a participant that is on medication, what do you do in those situations since they aren't necessarily grounded? Okay,
here you go. We've found, our experience has been, and in the TIR workshop, the TIR Association basically has these whole groups of medications that are contraindicated. But for the most part, we found that really there are very few medications that are problematic. Okay? There are the heavy psychiatric meds that basically keep you from accessing the memories that you need to work on. Sometimes people can work with antidepressants and anti-anxiety meds. They can work with sleep aids are problematic simply because people come in too tired sometimes. But in those cases, somebody can be asked not to take it the night before a session. But you don't want to simply tell somebody to stop taking their psychiatric meds.
Right, because that in itself could be a trauma because you're taking medication so often and then you stop one night for the session and then...
Yeah, that's a, sometimes that can be problematic, but we found that works. If somebody is able to come to session awake enough, we can talk hypothetically about why these things won't work, but in practice, they work more often than not. Okay? We found that we have no trouble with mandated clients once they find that, that we want to help them and we're interested in what happened to them and not what's wrong with them. We find that a lot of medicated clients, it works okay, depending on the medication. We always run that by, to see if that's one that's going to be problematic. Okay. Sometimes we'll try it and see if it works. Okay. Find more often than not that it does work, even when we would have expected it might not have. So the downside to this is that it might not work. Nothing's working for the person now as it is. So it's worth a shot, right? Okay, and the microphone's heading somewhere. Yes. And you're on.
I
don't think I need it, but
Okay.
I'm just curious because it seems like it's almost like EMDR. I'm sorry, my mind is not here today. But I don't see like, the bilateral stimuli. So
No,
I
you
guess
won't see that. That's a different
that's
process.
one, right? But it seems almost similar. So other than